Hello. Today we're going to talk about pain that comes into your buttock and runs down your leg. This is a very, very common type of pain, and many people suffer with it. And the real question is, where does this pain come from? Because once you know where it comes from, well then obviously you can do something about it and deal to it. There are two kinds when people describe this pain. There are two clearly defined types of pain. The one is an ache, which tends to have a fuzzy edge. It's deep inside. Often it's quite diffuse, and the person uses their hand and says, oh, the pain is here or it's here, and it's broad. So that's one type of pain. The second type of pain is a thin band, and it's a completely different quality. It's it's shooting, and in the medical text is described as lancinating, like there's a lance of pain shooting down your leg, and this is in a narrow band and has numbness and tingling with it. And these are two completely different pains. And if the person has the one pain or the other pain, and it's very clear, you can be fairly confident as to where that pain comes from. If it's this dull, diffuse pain, it's coming from a structure in your body. And a structure means a joint. So the joint would be something like the big joint in the spine, the sacroiliac joint, or the disc wall, the wall of the disc itself, the joints called the facet joints in the spine, and even the hip joint gives you a dull, aching pain which radiates sometimes down into your leg. Also, this kind of pain, this dull, aching pain, comes from muscles, and in particular from trigger points in muscles. So that's that one group. The second group, which is that sharp, stabbing pain with numbness and tingling, comes from irritation of a nerve. And the nerve, primarily the sciatic nerve. There's a second nerve called the femoral nerve, which also runs into the leg, which can also be irritated. That gives you pain down the front, and the sciatic nerve gives pain that runs into your buttock and runs down the back or the side of your leg, often reaching right down to your foot. So these two pains are very clear. Except, that's what happens in the textbooks, except people don't read the textbooks. And so what often happens is that you have a mixture of pains. So if you imagine that you, say, have a slip disc, and the disc wall is torn, so therefore you get a dull, aching pain from the tear of the wall of the disc, but then some jelly leaks out and it irritates the nerve, and then what you get is a sharp shooting pain. So you can have a mixture of the two pains. Then along the line of the nerve, where it is irritated, often you will get secondary trigger points set off. So very often people will have a mixture of pains, some of them the dull sort, some of them the shooting sort, and treatment can make treatment a little bit complex, but it also means that you always have the ability, even if you have pain, obviously from a nerve, if you treat the other pain, if you treat the joint pain, or you treat, most importantly, the trigger point pain, which you can do with acupressure, trigger point release, we've talked about that in other videos. You can treat it with acupuncture or local injections. You can get amazing relief of your sciatic pain, of what you think is your sciatic pain, but is really secondary trigger point pain in your buttock and your leg. So this little talk is really just so that you get an idea that there are the two kinds of pain: the dull, aching pain from joints and muscles, trigger points, the sharp shooting pain from pressure and irritation of a nerve, and when they're clear, but often the picture is mixed, which gives you the possibility for treatment both ways. If you presented with leg pain, buttock and leg pain to me, I would be looking, when I examined you, for either answering the question, is this coming from your nerves or is this coming from your other structures? And the examination findings when a nerve is being irritated is an abnormal straight leg raising. So as I lift your leg, if you have irritation of the nerve, I would not be able to lift your leg more than 30 or 40 degrees, and then you get this little band of terrible pain. The other thing that you would have is you'd have weakness, you would have abnormal reflexes, which is why I test the reflexes, and you'll have areas where there's reduced feeling. And if those occur, then that is objective evidence that you have an irritated nerve. However, at the same time, I would be examining for trigger points in three muscles: piriformis, gluteus medius, and gluteus minimus. And often those trigger points are secondary to the irritation of the nerve, and they may add in to the amount of pain that you feel quite considerably. So those I would treat either with acupressure, with acupuncture, with local injections of local anesthetic, together with specific stretches for each muscle. And if sometimes the component of pain from those trigger points is actually quite a lot of the pain that you feel. So treatment of them can sometimes give quite significant pain relief. Thank you very much.